Hello everyone, this is Vamshi Krishna. Welcome to my YouTube channel. Today we will see some of the basic multiple choice questions for upcoming staff nurse recruitment in Telangana. So the first question is, what is homeostasis? Options are body fluid, body temperature, nutrients. Option D is the all of the above. So the right answer is all of the above. So homeostasis is nothing but an equal amount of body fluid and equal regulation of the temperature and needed nutrients for the human body. It is called homeostasis. The next question is the number of metacarpal bones in each hand. So, how many numbers of metacarpal bones are present in our each hand? Options are option A 6, option B 10, option C 5, option D 8. So, the right answer is option C. So, metacarpals in each hand we have the 5. So, for both hand we have the 10 metacarpal bones. The next one is identify the picture below. So if you see the picture, what is the condition of, what is the name of this condition? This is club foot. It is congenital abnormality. The children are uh, facing this problem that is due to the abnormal genital condition, genital abnormality. So the next one is which part of the clavicle articulates with the manubrium. So articulate is nothing but joint. Okay. Options are option A shaft, option B sternal end, option C acromial end, option D coracoid process. The right one is the sternal end. So this is the clavicle bone. So this is the sternal end. So this clavicle bone is articulate with the manubrium. So manubrium is a part of the sternum. So the next question is how many bones fuse in adult to form a hip bone? So how many bones need to fuse the to formation of the hip bone? Options are option A 2 bones, option B 3, option C 4, option D 5. So the right one is the option B. So option B is the 3 bones. Those are ilium, ischium and pubis. So these 3 bones are formed together and form it is called as a pelvic bone. The next one is the how many bones are there in our upper limbs combined. So in our upper limbs how many bones are present? Option A 20 bones, option B 30 bones, option C 40 bones, option D 60 bones. So the right answer is 60 bones. So in our each hand we have the 30 bones and plus 30 is equal to 60. Okay. For the upper limbs we have the 60 bones. Those are humerus, okay, radius, ulna, carpals, metacarpals and phalanges all together, and the count is the 60 number. The next one is the muscles except one. So among these 4 options, which is not a muscle? Option A cardiac muscle, option B smooth muscle, option C tendon, option D skeletal muscle. The right one is a tendon. So this tendon is connect the bone and muscle. It is called tendon. The next question is the connection between the muscle and bone is called tendon. The right answer is tendon. The next one is a smooth muscle is present in. So where we can find the smooth muscle in our body? Options are heart, lungs, intestine and brain. The right answer is intestine. So in the intestine we have the smooth muscle. So in the heart we have the cardiac muscle. In the skeleton system we have the skeletal muscles. The next one is the cell membrane of a muscle fiber is called. So the muscle cell, okay, muscle fiber is nothing but muscle cell. So which is cover the a membrane. So what is the name of that membrane? Options are myofibril, option B sarcolemma, option C sarcoplasm, option D myofilament. The right answer is sarcolemma. Sarcolemma is a membrane which covers the muscle cell or muscle fiber. The next one is the postpartum period begins after. So when the postpartum period will start, options are option A, expulsion of fetus, option B, delivery of the placenta, option C, after cesarean delivery, option D, after normal delivery. So the right answer is option B. So after the delivery of the placenta, the postpartum period will be start. It is up to the 40 days. The next one is the cerumen is secreted in. So in our body, where we can find the cerumen? Options are eye, ear, nose, and mouth. The right one is the ear. So in our ear, we can find a gum-like sticky fluid that is called cerumen. So what is the function of cerumen? It prevents the entry of the pathogens and foreign bodies. The next one is the internal respiration is. So what is the meaning of internal respiration? Option A, exchange of gas between the nose and lungs. Option B, exchange of gas between the alveoli and blood. Option C, exchange of gas between the cells and blood. Option D is the none of the above. So the right answer is option C. So internal respiration is nothing but the gas exchange between the cells and blood. So what is the meaning of external respiration? It is nothing but alveoli and blood. The next one is the peritonitis. So what is the meaning of peritonitis? Options are option A, infection of pericardial layer. Option B, inflammation of the peritoneum. Option C, inflammation of the gastric area. Option D, infection to the abdomen. The right answer is inflammation of the peritoneum. So peritoneum is a fat layer which covers our abdomen. So when it is affected by the any microorganism and bacteria, so it called as a peritonitis. So inflammation of the peritoneum is called peritonitis. The next one is the presence of blood in urine. So when the person having the presence of blood in the urine, what is that condition name? Options are option A, hematemesis, option B, hematuria, option C, dysuria, option D, dyspepsia. The right one is the hematuria. Hematuria is nothing but presence of blood in our urine. The next one is the largest vertebra is. So what is the name of the largest vertebra? Options are option A, cervical, option B, lumbar, option C, thoracic, option D, sacrum. So the right answer is option B. So lumbar vertebra is larger than the other types of vertebrae. Those are cervical, thoracic, okay, and sacrum. So among this four, the lumbar vertebrae is larger in size. The next one is the most movable joint in our body. So in our body, which is called as a most movable. Options are knee joint, ankle joint, ball and socket, patella. So the right answer is ball and socket. So ball and socket we can see in the femur, okay, femur and pelvic bone, hip bone, that is nothing but hip bone. This is called ball and socket, hip joint, that is. The next one is the longest muscle in our body. Option A, sartorius, option B, gluteus, option C, deltoid, option D, stapedius. The right one is the sartorius. So sartorius muscle is the longest muscle in the human body. The next one is a modifiable risk factor for myocardial infarction. So modifiable risk factor is nothing but we can change. Okay. Non-modifiable is nothing but we cannot change. So here I am asking modifiable. Options are smoking, alcoholism, obesity, and age. This is non-modifiable. Sorry, here is a non-modifiable. Non-modifiable risk factor for the myocardial infarction is age. So age we cannot change, but smoking can be prevented, alcoholism can be controlled, obesity can be prevented. So these are the modifiable risk factors, and this is the non-modifiable risk factor. The next one is which gauze piece is used to between lips and ET tube for unconscious patient. So when you find the unconscious patient, you are assessing the unconscious patient. So the doctor has advised keep a gauze piece between the lips and the ET tube. So what is the purpose of that? So which type of gauze piece you have to use? Options are wet clean gauze piece, dry gauze piece, semi wet gauze piece, sterile wet gauze piece. The right choice is dry gauze piece. So why? Because the dry gauze piece will soak the secretions which are coming from the nose and mouth. The next one is the length of female urethra. So what is the length of female urethra? Options are option A 5 centimeters, option B 4 centimeters, option C 20 centimeters, option D 8 centimeters. So the right one is the 4 centimeters. So this is the shortest distance. Here we can see from the bladder to vaginal orifice, urethral orifice. This is 4 centimeters. The next one is the length of male urethra. So we have seen the female urethra. So what is the length of male urethra? Options are 20 centimeters, 15 centimeters, 10 centimeters, and 18 centimeters. So the right answer is 20 centimeters. So here you can see the picture. The urethra is start from the urethral canal, start from the bladder to urethral orifice. Okay, it is come through the penis. So the distance of this urethra is the 20 centimeters. The next one is a hospital acquired infection most common due to. So what is the main cause and common cause for the acquiring of hospital infection? Hospital infection is nothing but nosocomial infections. Options are poor, poor urine output, poor perineal hand washing, and urinary drainage bag, and improper catheter care. The right one is the improper catheter care. So when you are not doing a proper catheter insertion, and during the catheter insertion, if you are not maintain the aseptic techniques, the patient can get the a common hospital acquired infections. The next one is to achieve high level of disinfection in 2% glutaraldehyde and soaking a instrument. So when you want to soak a instrument with 2% glutaraldehyde, so how much time you have to soak in the 2% of glutaraldehyde? Options are 30 minutes, 20 minutes, 15 minutes, and 10 minutes. So the right time is the 20 minutes. For up to 20 minutes, we have to soak the instrument with 2% glutaraldehyde to get a high level of disinfection. The next one is the most important step in clinical area of waste management. So during the waste management, that is biomedical waste management, so which is the most important step? Options are transportation, segregation, storage, and labeling. The right one is the segregation. Segregation is nothing but separation. So which is metal, which is infected, which is not infected, which is plastic, which is blood content, which is tissues or bones. Okay, so you have to segregate them and separate, and according to the biomedical waste management, we have to dispose safely. That is segregation. So the next question is, which pituitary hormone stimulates the secretion of breast milk from the mammary gland? Options are vasopressin, luteinizing hormone, human chorionic gonadotropin, and prolactin. So the right answer is prolactin. Which assessment finding is not related to a preterm newborn? So among these four options, which is not related to preterm preterm newborn. Okay, options are soft earlobe, lack of vernixiosa, long nails, and low birth. So the right answer is long nails. So long nails we can see in the postterm baby. So remaining three options we can see in the preterm babies. The next one is what is the first assessment of newborn? So when you find a newborn, so what is your first assessment? Options are suction, respiration, Apgar score, and meconium. The right one is the respiration. So we need to assess the respiration for the newborn. Then we need to go for the Apgar score. The next one is another name for knee chest positions. Okay, what is the name of other name of knee chest position? Option A dorsal, option B Sims, option C genorectal, option D lithotomy position. The right one is a genopectoral position. This position is also known as knee chest position. So the last question is the pentavalent vaccine protect against. So what is the pentavalent vaccine which is used for the protect against which type of diseases? Option A DPT measles and rubella, option B DPT polio and hepatitis B, option C DPT polio and hepatitis A, option D DPT HIV and hepatitis B. So this is the right answer. So pentavalent vaccine is used to prevent the diphtheria, pertussis, and tetanus, HIV, and hepatitis B. So thank you guys. This is end of my class.